Hello, and welcome to Grand Rounds for the Minnesota Regional Spinal Cord Injury Model System, also called MSCIMS. We would like to thank you all for joining us today. MSCIMS is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDILRR, to support innovative projects and research in the delivery, demonstration, and evaluation of medical, rehabilitation, vocational, and other services to meet the needs of individuals with spinal cord injury. Next slide. MSCIMS represents an exciting partnership among the following Minnesota institutions: Courage Kenny Rehabilitation Institute in Minneapolis, Mayo Clinic in Rochester, Regions Hospital in St. Paul, and the University of Minnesota in Minneapolis. Next slide, please. Our community collaborators include the Minnesota Spinal Cord Injury Association, Unite to Fight Paralysis, Get Up, Stand Up to Cure Paralysis, the Paralyzed Veterans of America, the United Spinal Association, and the North American Spinal Cord Injury Consortium. This system collectively provides a multidisciplinary continuum of care for people with spinal cord injuries, including emergency medical, acute care, acute rehabilitation, and post-acute services. My name is Kimberly Mondin, and I will be the moderator of today's session. I'm an associate professor in the Department of Rehabilitation Medicine at the University of Minnesota Medical School, and I'm co-project director of the model systems with Dr. Leslie Morse. Next slide, please. A few housekeeping notes to start with. So the University of Minnesota has organized the CME for today's webinar, and you can look in the chat for information on how to record your attendance and claim your CME credits for attending the webinar within 24 hours of the event. This meeting is being recorded and will be posted on our website. Due to the number of registrants for today's webinar, we have placed phone lines on mute to reduce audio feedback. However, we welcome and encourage audience participation using the Q&A function. If you have technical or logistical questions, we ask that you please submit those in the chat to Dan Kelly. And we would also like to thank all of those who work behind the scenes, especially Dan and Amanda, to make these webinars possible. Next slide. The title of today's presentation is Integrative Health Approaches for SCI, Acupuncture and Adaptive Exercise. The speakers for today's webinar are Sophia Bouwens and Ricky Lopez. Sophia is a licensed acupuncturist with a background in neuroscience. She obtained her Bachelor of Science degree in Neuroscience in 2010 from the University of St. Thomas, and her Master of Science degree in Acupuncture from Northwestern Health Sciences University. She found acupuncture through her own struggle with paralysis after the onset of Bell's palsy following a snowboarding injury in 2004. As an undergraduate student in neuroscience, she had a second onset of Bell's palsy, and seeing it through the lens of neuroscience opened her curiosity. She got curious about how acupuncture could modulate the nervous system and completed a capstone study on acupuncture and nociception when she had the honor of representing at the Society for Neuroscience in Chicago, Illinois in 2009. She went on to get her master's in acupuncture from Northwestern Health Sciences University, which she completed in 2014. In March of 2015, she was hit by a drunk driver on the way home from work and woke up 1 week later in Regions Hospital after suffering a severe diffuse axonal traumatic brain injury, among other numerous injuries. She attributes the team at Regions Hospital for saving her life and experienced firsthand the immense power of acupuncture to assist with neurologic rehabilitation alongside the frontline care she received. After 1 month of inpatient and months of outpatient rehabilitation, Sophia renewed her passion for neurologic care and rehabilitation. She went on to complete postgraduate training in functional neurology and applied clinical neuroscience through the Carrick Institute. She began working with the neuroscience research team at HealthPartners in 2018 and has joined Regions Hospital outpatient rehabilitation as an acupuncturist in 2020. She is interested in the connection between sensory and motor systems, nociception, exploring neuroplastic change, and neuromodulation using acupuncture as an intervention. In her spare time, she loves being out in nature with her 3 children and husband, sailing and dancing. Our next presenter, Ricky, has been an exercise physiologist at the HealthPartners Neuroscience Center since 2019. His primary roles include developing and leading exercise programs and wellness services for community members with neurologic injuries and disorders. Along with other rehab specialists, he facilitates the NeuroWell programs at the Neuroscience Center, which include exercise and acupuncture. He completed the Mayo Clinic Certified Wellness Coach program in May of 2023 and will be completing the board exam in November of this year. He also facilitates the exercise program for the state-funded research study, examining the effect of an adaptive exercise program on chronic inflammation in SCI, led by Dr. Stephen Jackson and Amanda Herman. Overall, he is passionate about providing opportunities for people with neurologic injuries to pursue lifelong health and wellness. Welcome, and thank you both for presenting today, and I will hand it over to you.
All right, thank you very much. We have no conflicts of interest to report today. So today's presentation will explore the importance of exercise and adaptive exercise programming for spinal cord injury. We will also introduce the NeuroWell Adaptive Exercise Program located here at the HealthPartners Neuroscience Center. My colleague Sophia will present on acupuncture and applications for spinal cord injury. Then we'll dive into a case study and explore a collaborative approach between both exercise and acupuncture with a current participant in the NeuroWell program. At the end, we should have some time for Q&A to address questions. If not, Sophia and I will provide our contact information. We will welcome further discussion and engagement. We'll start off today's presentation discussing the novel extension of the traditional neurorehabilitation continuum of care, where programs that promote health and wellness can exist on the continuum in an effort to optimize patient care and community health promotion. Unfortunately, my colleague Andy Rapaz, fellow exercise physiologist, couldn't be here today as a co-presenter, but he found a way to share our passion and vision through a video contribution.
Hello, my name is Andy Rapaz. I'm an exercise physiologist in the NeuroWell program at HealthPartners Neuroscience Center in St. Paul. My colleagues will get into the meat of some of our NeuroWell programming and initiatives, but I want to briefly, especially in the context of the grand rounds, revisit the neurorehab continuum. Let's scale things out and now look at it as a lifetime neurorehab continuum. As NeuroWell, we operate under the fitness and wellness umbrella. We are not therapy. It's an important distinction, and a distinction that sometimes is hard for our clients and even us to understand. But here's how I like to think of it. In therapy, the primary goal is to improve function. And a great secondary benefit of some of the things you may do is you'll see improvements in health and wellness as well. In a fitness program, our primary goal is to improve health and wellness. And a great secondary benefit of some of the things that we do is we see improvements in function as well. Also important to note that in fitness and wellness, we historically bill as cash-based services, meaning clients are privately paying out of pocket using scholarships or grants for participation. We also tend to see people more on the chronic side of things. So with that in mind, we know the consequences of a sedentary lifestyle are well documented in the able-bodied population. Thinking specifically about spinal cord injury, we have a population of inherently sedentary individuals, possibly not by their choice. What does that mean? Well, it means that we need to find lots of new and creative ways to keep people healthy, to keep people moving, and to keep people connected to their bodies. And that is what we as NeuroWell are trying to do. How do we do that? Well, we hope that we can help build cost-effective programming based on current guidelines and research. We want to collaborate on specific research initiatives to promote and develop holistic, integrative approaches to spinal cord injury and other diagnoses. So hopefully that provides a little context for who we are and what we do. With that, I will turn things over to Ricky and Sophia, and our participant, Gabe.
So when we think about how exercise can impact health outcomes in a human being, we consider a high-level understanding of how human physiology responds to an exercise challenge. Muscular contractions during an exercise session lead to a perturbation of the resting energetic state, which we refer to as homeostasis. Multiple physiological systems coordinate and integrate to respond to an energetic challenge that exercise imposes. Exercise serves as a signal for our physiology and anatomy to remodel and defend homeostasis next time around. The result is a more resilient and fit physiological system. The adaptations we see during structural remodeling and changes in function become protective or health promoting factors. These responses and adaptations tend to be more pronounced in high intensity, whole body, dynamic, appropriately dosed exercise that engages a large amount of muscle mass. Exercise is a fundamental behavior in improving physical fitness and promoting health for all ages and health statuses. We can move to the next slide here.
Ricky, this is Amanda. Do you want to stop sharing and I'll share my screen?
Well, I can try again to reshare it. I think the computer just kind of froze up.
I can go ahead and share it. I have it pulled up here.
Okay.
1 second.
Oh, looks like it's working again. Is it still sharing? I can share it now. Hold on.
Okay.
I can share it. All right, let's try this again. So the health promoting effects of exercise in humans are well established and supported by an overwhelming amount of evidence. There are well over 100,000 plus studies supporting claims that exercise can impact the health span. The image we are looking at provides a brief peek into some of the health benefits that impact a variety of systems and organs that promote health on the whole body or whole human organism level. The effects of a spinal cord injury can disrupt the normal mechanisms and adjustments that lead to health promoting outcomes from exercise. Yet, health promoting effects of exercise can still be accessed after a spinal cord injury. The mechanisms by which these health promoting effects occur are not within the scope of today's presentation, but it is an active area of investigation and exploration. Some theories lean towards redundancy in physiological systems, plasticity within the nervous system, or possibly residual or preserved innervation. It's not a surprise that exercise is great for health, but the question becomes, can the health promoting effects of exercise be accessed after a spinal cord injury? And in fact, they can. While this is an active area of exploration and research, there is evidence to support that many of the same health promoting benefits that are seen with exercise in able-bodied humans are accessible to those who have experienced a spinal cord injury. While the magnitude of the benefits can vary based on a variety of factors associated with having a spinal cord injury, many of the benefits listed here have been demonstrated in a wide variety of levels of injury and completeness of injury in adults with chronic spinal cord injury. Many major organizations have developed exercise guidelines for the spinal cord injury community based on the evidence that supports the benefits listed above. Current guidelines suggest for a goal of improving fitness to engage in at least 20 minutes of moderate to vigorous aerobic-based exercise two times per week and 3 sets of strengthening or resistance training for each major functioning muscle group at moderate to vigorous intensity. It seems for more cardiometabolic improvements in the profile for cardiometabolic health, it is suggested to engage in at least 30 minutes or more of moderate to vigorous intensity aerobic exercise and resistance training 3 times a week. So it seems like for the cardiometabolic benefits, there's a little bit higher of a dose of exercise. So considering the challenges and disability that can occur after a spinal cord injury, there becomes a need to adapt or modify the mode of exercise to meet the abilities of the individual. Adaptive exercise aims to optimize the exercise prescription and health promoting effects, maximize neurologic recovery, provide an enjoyable, inclusive experience, and ensure safety. There are a variety of adapted exercise modalities and equipment available. Some of the ones listed below are body weight supported treadmill, which here at the Neuroscience Center, we have a 0G system. It's a robotic device with a harness that allows for offloading of body weight and allows for adjustments in intensity during weight bearing activities and exercise, as well as improvement in task specific performance. Functional electrical stimulation, so facilitation of muscle contractions and paralyzed muscle, can be applied to a variety of tasks and functions such as rowing, hybrid arm and leg cycling together, ambulation, stair stepping, squatting, sit to stands, resistance training. So a lot of different applications for using functional electrical stimulation. Assistive gloves to ensure a fixed, stable grip when there's fine motor deficits. Resistance machines developed to allow easy access for wheelchairs and compatibility with adaptive tools. Gait belts that can be used during walking activities and exercise, but also used creatively to provide stability or support advantageous positions for safety and improved exercise training effect. Ambulation over ground and body weight supported harness that offers, again, the ability to control weight bearing load. So you can do a treadmill or you can use over ground exercise on the track system of the zero G unit that we have here. We can use adapt a sled to improve certain functional performance parameters specific to wheelchair locomotion or resisted gait in different directions. Mats and tables that vertically can be adjusted to accommodate transferabilities and needs and support exercise prescription for trunk and pillar strengthening activities. Parallel bars, wheel chocks for stability of the wheelchair can also be used as well. And here's just a few pictures from some of the equipment that can be seen in adaptive fitness programs or adaptive exercise programs. So the picture on the left is a chest press machine where this individual who's a participant in the program, he was able to transfer onto this machine, but he could have also used a wheelchair to get into this specific chest press machine. So it's wheelchair accessible and adapted to allow a variety of individuals to improve strength on this machine. And then there's a few other pieces of equipment, arm cycling, an arm ergometer, again, functional electrical stimulation cycling. So stimulation to paralyzed leg muscles that allow for a cycling motion and repetitive muscle contractions. Paramill, so it's like a wheelchair treadmill to work on performance in a wheelchair. And then cable or pulley machines. That particular device has a back support as well to facilitate strengthening activities while also being stabilized and supported. So here at the Neuroscience Center, we offer the NeuroWell Adaptive Exercise Program. This program is located within the Neuroscience Center Rehabilitation Department. Participants pay a fee to access exercise and wellness services. When cost is a barrier, limited scholarship funding from strategic foundation partners or grants supporting research participation may be available. NeuroWell programs are developed and often led by a variety of rehabilitation disciplines and medical professionals. This model of care aims to break down barriers and bring experts together with a variety of skill sets together to develop high quality, effective programs that optimize care for patients, care partners, and community members along the neurorehabilitation continuum. Seeking research opportunities is of high interest for this program. NeuroWell is currently hosting 2 active research studies. One is investigating the effects of an adaptive exercise program on chronic inflammation after a spinal cord injury. The principal investigators on this study are Dr. Stephen Jackson and Dr. Amanda Herman. The other study is investigating remotely delivered cognitive multisensory rehabilitation for sensory and motor recovery after a spinal cord injury. Recruitment is currently open for this study. Unfortunately, recruitment for the chronic inflammation study is closed, but we do expect to host new research opportunities within NeuroWell in the future, so stay tuned. Julian Ziereth is a pioneering exercise biologist and a member of the Nobel Committee for the Nobel Prize in Physiology or Medicine. This quote reads, "Regular exercise is among the most powerful health-promoting and disease-modifying behaviors readily available to humans." And, this quote is just a reminder that exercise programs are powerful and should be considered carefully when optimal health and wellness is a priority. So from this point, I'm going to pass the baton to my colleague, Sophia, and she will introduce herself and get into some of the applications of acupuncture within the NeuroWell program.
Well, thank you, Ricky. I appreciate the opportunity to be here and partner with you and talk about acupuncture applications for spinal cord injury. I had to go back into the archives for information in this presentation. I work in the field with you of neurologic rehabilitation at the Neuroscience Center as an acupuncturist. The medical ring I play in is among the most cutting edge and some of the most ancient. In preparing for this presentation, I have articles from earlier this year and sources as old as 4,000 years old. Acupuncture has been used for thousands of years, but the medicine itself comes from a world away. It's bridged from east to west and also had to bridge worldviews and millennia. Predating the invention of the microscope, it has very different language of talking about the body, the way it functions, and how it interacts. But just because the language is foreign to us doesn't mean the concepts are out of reach. We talk a lot about different things in acupuncture, and I'll get into some of those here. I won't dive too much into things, but I find acupuncture to talk to the nervous system in a really amazing way. I'm excited to share that with you guys today. Next slide, please. Before I dive in too much, I want to give a big thank you to the Minnesota Spinal Cord Injury Medical Care System for hosting this, for Dr. Amanda Herman and Marnie Farrell, whose partnership and efforts to get acupuncture in neurorehabilitation make this work possible. Our provider partners who refer patients to us and partner with us to get them better. And a big special thank you to Gabe McGuire, who's here to share his experience and testimonial with the audience today. Next slide. I'm going to start by talking a bit about what acupuncture is. There's a lot of information out there, some misinformation and some fantastical information. So for the scope of this presentation, for a wide range of audience members, I want to just define it how I view it, how I see it, and what it is. I'll talk about acupuncture applications for neurological rehabilitation as a general rule, and then get into acupuncture for spinal cord injury rehabilitation. I'll go through a state of evidence today, as it lies, applications for this evidence, and then a little bit of our case study that we did collaboratively together with Neurowell and Acupuncture. And you'll get to meet the patient, Gabe, and his case study patient testimonial. At the end, we'll have time for a discussion and question and answer. Next slide, please. So first, what is acupuncture? Acupuncture is defined by the National Certification Commission for Acupuncture and Oriental Medicine as the stimulation of specific points on the body by insertion of very fine, sterile, stainless steel needles to elicit a predictable physiological response. Click forward. This is an image of just how big acupuncture needles are. They're very small. You can fit about 10 to 25 of them in the hole of a hypodermic needle, or the needle you get a shot or blood draw with, about the thickness of a cat's whisker. People generally feel them going in. Once they're in, they're very comfortable. Acupuncture has an effect on whole body health. It has a profound effect on nervous system regulation. Neurologic treatment is a large focus for acupuncture therapies in hospitals in China and East Asia. Most people don't know that stroke is the #1 thing acupuncture is used for in the East. Acupuncture comes from traditional East Asian medicine, or TEAM. Next slide, please. Acupuncture uses a lot of this fantastical conversation. Most of us are familiar with the word qi, or this energy that's used. People often ask me, what is qi? I had this question myself when I started exploring acupuncture. I've come to know it and understand it as function. A classic text tells us where the qi goes, blood flows. Where the blood flows, return to function and health and wellness is possible. Acupuncture came about in a worldview that didn't understand what an axon was or an ion gradient is. So the way that they described function was that there's some energy exchange or some action that happens, that qi arrives, and then this function recovers. Next slide, please. We see this effect when we put acupuncture needles. Oh, can you go back one, Ricky? When we put acupuncture needles in the body, we get this red response around the needles. Our ancient texts tell us that the qi has arrived when this happens. We now know this to be blood flow, and a slew of neuroactive mediators and immune components come to the site. Now you can click forward, Ricky. Thank you. So this isn't for the audience to memorize, but it's to give an idea of just what's begun to be understood in response to acupuncture needle insertion. We have immune components such as mast cells and macrophages come to the site. We have antihistamines or cytokines that come forward. We have a lot of neuroactive mediators and different components of our blood and immune system that respond. And an interesting thing about this is it can be point specific. So some cells stimulate more mast cells, some cells stimulate more dopamine or enkephalins or endorphins. They're just very different in how this is relayed in the system, and a really big area of study for profound effects on our whole system. Next slide, please. As a neuro rehab therapist, I think of it this way. When I'm looking at a nervous system or a body, there is a sensory motor hypothesis of the nervous system that came about by Charles Eccles at the turn of the century, late 1800s, early 1900s. And he developed the sensory motor hypothesis of the nervous system, and that our nervous system's main function is to take sensory information in to create a motor response out to help us interact and respond appropriately with our environment. In order to do this work, nerves require blood, nutrients, immune components travel in there, oxygen, which flows with the blood, and stimulation. Without any one of these three things, nerves tend to atrophy and die. There's also an important law called Hebbian law that says that nerves that fire together wire together. We use this a lot in neuro rehab to get systems to come online or to link reflexes together or to help influence changes in our system. So this is a really important foundational piece I'll touch back on later when I'm talking about how I think about using applications to the nervous system. Another really important thing about acupuncture is that we've started to realize that there's point-specific activation of the central nervous system. So this is to say that specific acupuncture sites, we're now seeing that the neurophysiatry of how they activate or alter different centers in the central nervous system, being the spinal cord, the brainstem, and the cortex. These are point specific and their indications, meaning if we activate a point on the hand, Li4, we will get a reliable reaction into the spinal cord, up that dorsal horn column, and into the brainstem, through the brainstem to the periaqueductal grate in the midbrain, which activates a pain center, kind of turns down the volume on pain altogether. So this might be one of the reasons why this classical point known to move chi and blood and powerfully stop pain actually has its effect. There's a number of other nuances about this. For example, a point on the lower leg, classically indicated to quell wind and stop tremor, looks like when we activate under an fMRI and see what happens with that stimulation, we get ipsilateral, or the other side of the motor cortex, activated there. When you have this central activation of the motor cortex that controls movement strengthen or be activated, it tends to help coordinate movement and quell things like tremor. I'm fascinated by this body of literature. You can go back. Next, I'll just wait till I say next slide. Thank you. It's kind of tricky with having multiple people with the slideshow work. You're doing great. Thank you.
Sorry.
Oh, that's okay. When we get these activations of point-specific areas in the nervous system through the classical indications, the overlap of those things really fascinates me in my study. And I also see that I have a window into getting different areas of the nervous system to activate if I know this physiatry of the acupuncture points. So in spinal cord injury, there's some considerations we need to take with regard to where and how their injury is affecting their nervous system. But evidence that looks at the effects of these points still has some really good viability in patients with spinal cord injuries. We can get everything from peripheral nerves, muscles, blood flow activated, and then we have a window into areas like the spinal cord, the brainstem, and the cortex to help with other functions as well. Next slide, please. So we know that this is the sensory motor hypothesis of the nervous system, requires sensory information in to create a motor response out, requiring blood, oxygen, and stimulation to function. And then acupuncture, now I hope I've established as a sensory stimulus that activates muscular, immune, and neural components. So it's really set up nicely when seen through this window to be an effective therapeutic action, have an effective therapeutic action on the central nervous system. Next slide, please. So, click one more time. This image, a lot of research is starting to come out in regards to acupuncture, especially with regards to nervous system and spinal cord injury recovery. This is from a paper published in Frontiers of Neuroscience last year, looking at the bibliometric trends of research or acupuncture for spinal cord injury. The authors did a quantitative and a qualitative analysis to see how much evidence was coming out with acupuncture and what it was saying and what high quality it was in. You'll note that in the past 10 years, 2011, there was around 5 publications, and in 2020-21, there was over 20. So this is a very big growing area of research evidence. That being said, while we have thousands of years of effectiveness to show from it, this paradigm of research is new to the East and into this type of medicine. So the evidence has really changed in quality over the past 10 years. A lot more high quality research is coming out from places like China or Europe, East Asia, that is looking at the effects that were being reported. When I first started researching acupuncture back in 2008, the evidence was promising, but was riddled with issues as far as replicability, how the data was analyzed, or other things like bias, how that could influence the results of the study. The past 10 years has changed quite a bit in some of the evidence. So when we're looking at this, we need to have a critical eye and ask questions about who published this, when, or how it was published, and then look at the data that's coming out. But lucky for us, groups have done that, and I'll share some of their findings here. Next slide, please. This is an analysis from that same paper studied in Frontiers of Neuroscience last year. They found of 213 publications since 1979, they found 25 high-quality, replicatable, or cited studies. And they found that of these 25, 7 of them were reviews, 14 of them were experimental research papers, and only 4 were clinical research papers. The experimental research papers were mostly in animal models, looking at that cellular, molecular, physiatry, or biology of acupuncture intervention. And they found strong evidence for inhibition of apoptosis, which is a cell death that happens at the site of the injury, improvement of the microenvironment, so circulation that brings blood and healing to the nerves, especially at the site of injury. That gets improved with acupuncture. And then promotion of nerve regeneration and plasticity is also promoted through acupuncture. There's strong evidence for the reduction of oxidative stress and glial scar formation, which is something that inhibits the nervous system. When the central nervous system is injured, it has a hard time actually creating a good response and gets this glial scar formation, which can hinder the cell signals through the spinal cord and limit recovery, and that can be attenuated through acupuncture. Acupuncture can also have a regulation of the expression of biological mediators, such as endogenous neurotropic and neurotrophic factors, which help with plasticity and nerve regeneration. And one really interesting, fascinating area of study that I started to read some papers on was the promotion of neural stem cell proliferation and differentiation. Having mesenchymal stem cells into the blood and using acupuncture as a guide to get them to go to the site of injury, and is showing some great potential. While we were looking through, oh, we can scroll back, it's too fast. Go back a bit. Thank you. This is a lot of text on the side, so I want to go through just one thing for the audience at a time. We found this paper published in 2021 called The Effect of Acupuncture Therapy Combined with Rehabilitation Training on Incomplete Spinal Cord Injury. It was a randomized controlled clinical trial conducted in China. So one of the limitations is that these were only Chinese participants, but it did find some really interesting things. We liked this study because it had a wide capture for injury. They just had to have a spinal cord injury through trauma or surgery and be in a stable phase, like post the acute phase or any surgery they needed, and able to answer questions and participate in the study with good awareness. They didn't have a large cutoff window of how long they had to be pre or post intervention. So some of them were 18 years post injury and some were like 6 months post injury. They had 3 groups of patients with 24 patients each. So another limitation is the small sample sizes. But the first group we deemed the intermittent acupuncture group, which received acupuncture 3 times a week and rehab training. The rehab training wasn't like what we do in the NIDILRR program with exercise. It was basic, like sit to stand or other kinds of things you do in more acute care rehab. The second group was the continuous acupuncture group at 5 times a week with rehab training. And the third group just had rehab training, no acupuncture. They looked at ASIA score at baseline, so before they started, and then at 4 weeks, ASIA is a motor score. The secondary was a modified Bartel index, which is a measure of activities of daily living and quality of life, and also a sensory score. They had rehab therapists other than acupuncturists look at the results, and they found some interesting things. They had significantly improved ASIA motor score and MBI at 4 weeks. And they saw no significant change in sensory score, but I do think that that's because the limitation of the timeline. I usually see that it takes about 12 weeks for sensory information to start to change. One interesting thing they find is that it was dose dependent on the level of acupuncture they had, meaning acupuncture 5 times a week had a greater change than acupuncture 3 times a week, which had a greater change, where they saw no significant change in the no acupuncture group. So we took this and thought through, well, how could we prepare for this study, and could we find a patient who might be willing to work with us to see if we can find some things too. So we did, and you'll get to meet him in just a minute. He's a 43-year-old male with a spinal injury at C4 to C5, with a spinal cord injury at C5 after falling from a tree. Here's an image of his spine after he fell. We started working with him 7 years post-injury. He's tetraplegic, having very little motor function in his right hand, and his upper body was his main focus of exercise and recovery. He had previously injured his left scapula, and with his fall, he hurt his right shoulder, so he has a good amount of upper body trauma. He also notices some autonomic changes in body temperature regulation, where it's more difficult for him to stay comfortable at a temperature of any given, like hot or cold. So we came to the table, we did acupuncture 3 times a week. I did acupuncture along his spine. You'll see in the picture there, one of the areas we did. His acupuncture prescription consisted of points in the hand, the points between the fingers that have the black clip on the side of the screen there, to a motor point in the elbow, a number of points along the arm to get activation of the nerves and blood flow to the muscles, along with activation of that spinal cord area, those points that we have there connected with electrical stim, and electrical stim on the ipsilateral or contralateral area of the scalp that controls motor movement. After our intervention, we saw some good changes. Go ahead and click through. He had decreased spasticity in his hand in the morning on the right side. A big issue for his movement is that he has a lot of spasticity. One of the unexpected and really great changes that Gabe saw was he had improved bladder and bowel control and regularity, where he was able to go almost, I think, a month without having to wear any supportive underwear or diapers, which was big for him. He also saw improved energy and alertness. Some of the limitations was that we had a short intervention period of less than 4 weeks. We had only 10 of the 12 visits completed due to sickness and transportation issues. And at one point, we had to discontinue using the electrical acupuncture because he kept having his heart rate drop after acupuncture before exercise. So we did 3 sessions without it before we introduced it again, and he was able to tolerate it better at that point. So we didn't get as much of the benefit of the electrical acupuncture, which does exert a significant effect on the nervous system. Can we play these videos? We don't have to play the full 3 or just a little bit of it. This is his hand before treatment on the right side.
That's all you get.
How about the left? Kind of move his wrist. This is his most mobile limb. And Ricky, if you want to stop there and play the post one, that would be okay. And this is post-treatment. You see some motor activity or like a little bit of trembling from that working to come back online. Better traction of his thumb and his index finger, although still not incredibly reliably. Smoother movement. I think that's good. You can stop. All right, now for the sake of time, I'm sorry that we ran over a little bit, but that was our case. And I think that Gabe is ready to talk to the audience now. Do you want to skip forward to citations or here in the presentation? I think you'll have access to the slideshow at the end.
Thank you for a great presentation today. And I'd like to take a moment to introduce Gabe, our discussant that Sophia has been talking about. So Gabe was injured in September 2017 in a tree accident at home, which resulted in a C5 incomplete SCI. He lives in White Bear Lake, Minnesota with his beautiful wife and daughter, who was only 6 months old at the time of his accident. Sorry. Prior to his injury, he worked for Cintas for 10 years, running his own delivery route and training many new drivers. Currently, he is participating in the HealthPartners Neuroscience Center's NeuroWell exercise program. He has also participated in several research studies, including HealthPartners study examining the effect of adaptive exercise program on chronic inflammation in SCI, as well as the University of Minnesota study involving neurostimulation and fine motor control. So Gabe, we want to really thank you for joining us today and hand it over to you to discuss your experience and also open up the Q&A if people have questions to ask our presenters.
Sure. Yeah. Thanks for having me. Yeah, I couldn't be more excited to be part of this. I'll try and keep it to 5 minutes. So if I run long, let me know. But yeah, some of the biggest benefits have come just because of the exercise. Probably the biggest thing that happens when you are injured or paralyzed like this is you lose your independence immediately. you're having to have people help you or ask for help, which is really hard for people, or at least me in my own person. So getting just started in exercise, getting out of bed, just the mental struggle, the exercise, it's crucial. So, and the benefits, mental, physical, and, just the little things that you can do for yourself to just participate in life again. You know what I'm saying? To contribute, and the strength and stuff of that. I mean, it's unmeasurable. I don't mean to gush, but the things that I can do now since starting the program, I don't know if you guys remember that 2 years where we were kind of shut down. Yeah, that was really tough. So over those 2 years coming back, I'm able to. I remember meeting with Ricky when we started the process for just the NeuroWell program, and I'm doing the study for him. And some of the goals he asked me what I would like to do, and I thought it was out of possibility. I'm like, well, I got these 40-pound bags of softener salt. I'd like to be able to help my wife, put the softer salt into the softener. And then he said, okay, that's a good goal. And sure enough, I mean, within 6 months, I was able to do that. And just things like that to benefit my family and my wife are, I can't say enough. It's necessary. People, I will say, to Andy's, when he was saying the cost effective part of this, I think that is probably the only hindrance I would see to anybody taking advantage of an exercise program. But I just can't say enough of what it does physically, mentally, to have that back, and it's just amazing.
Thank you for sharing. And sorry to interrupt, but Ricky, would you mind stopping sharing your screen so that the people attending can see the full panel? Perfect. Thank you so much. Gabe, thank you for sharing your experience. Did you have anything else to add? I hope I didn't cut you off.
Oh, no, not at all. Like I said, I could just, blush about it all day long. But yes, the last 4 weeks working with Sophia as well. Again, unexpected advantageous, however you want to say it. But yeah, it's, just those little things that you try and do, and then all of a sudden, you make a change, and it's great. So I'm glad you're allowing me to be able to speak on behalf of the work that you do, because it's affecting real people, so if I can advocate for anyone else, I would. I definitely, anybody I see at the program, I ask them if they're in the NeuroWell, why aren't they in the NeuroWell, have you tried acupuncture, are you afraid of it, just things like that. But yeah, again, I can't say enough good things about everyone I've worked with at NeuroWell and HealthPartners, just in general. So
Well, thank
hats
you.
off.
I noticed there was a question in the Q&A. Sophia, it looks like you answered it, but I'll just kind of read it for people who didn't see it. So someone asked, have you noticed a significant or minor difference between acupuncture with and without electrical stimulation? Has there been any data on the frequency of autonomic dysreflexia from acupuncture in SCI patients? And Sophia said, absolutely, I see benefit of acupuncture with only needles, but also see more profound and reliable changes with electrical stim. There are data on frequency and rate of stimulation with regard to electrical acupuncture, but not enough to form clear guidelines, especially in SCI. And we need to do more research in that area.
Yeah, this is a great question. I like to think of the nervous system as an electrical system. And I say, when you can speak to it in its native tongue, it just really loves it. So we do have a lot of evidence building about kind of what frequency and what rate affects different tissues or different structures in the central nervous system to affect different functions. But these are in able-bodied populations, and not a lot of evidence is there in the literature for spinal cord injury patients. The evidence we do have says it's safe, but I think it's something I closely monitor with my patients to make sure that I'm not driving too big of a burden on their autonomic system and create a good therapeutic benefit. And it would be a really amazing area to have more, well, reliable resourced data on just this question.
I was muted. You would think by now we would all stop doing that. We have another question about insurance reimbursement for acupuncture. I know that's always a question people have. What's your experience with that, Sophia?
Insurance can be, most insurances do cover acupuncture coverage. The most reliable thing it's covered for is pain. I have to check with each plan, and each plan, like payer, will have their own little nuances where some people get 12, some people have unlimited. It just really depends, but there is growing coverage, and with growing evidence, I think that's changing too. So check with your plan and then your specific plan, like your provider of the plan and then the specific plan, and then check to see that the condition you're going in for therapy for is covered, because there's a limited number of conditions. Generally, if you're in pain, that's a really well covered code.
Great, thank you. And then one last question here before we close today. One of the participants asked, much of the research so far seems to point to individuals with incomplete injuries. Has there been any research or results for individuals with complete injuries?
There has. I didn't look as closely at that, because this study that we had on incomplete injury was was one of the ones we built our case study for, but there are research articles out there, mostly in animal models, on different types of injuries, complete injuries, incomplete injuries. So there is evidence out there, but it's very little, and there's not much we know in that arena at this time from what I could gather in the literature.
All right. One person asked, how do I get it in? I'm assuming they're saying New Jersey. So I'm not sure if you're able to answer that question.
How do you acupuncture in New Jersey? This is a good question, though, because there's a lot of different types of providers that will say they do acupuncture. You can get certification with as little as 200 hours if you have a chiropractic license, for example. As a licensed acupuncturist, you have over 2,500 hours of acupuncture-specific training. So that's a very different toolbox you have to work with, and the therapy you apply is going to be very different. So for the most reliable outcome, look for someone who has LAC after their name. That stands for licensed acupuncturist. And then I would, if you can, look for something that has neurologic training. There are a few like neurospecific groups, networking groups in acupuncture that if you send me an email, I think at the end of this we'll have some. I'd be happy to like find someone kind of close to you. The closest to New Jersey I know is New York off the top of my head, but I can help you find someone or get access to someone who's neurologically trained. Just like other medicines, we have specialties, right? So some of us are really good at fertility, others are great with pain or nervous system. So finding someone with neurologic training, but the most important thing is that LAC after their name.
Great. Ricky, could I ask you to share your screen one last time so we can
Yes.
show the closing slides?
Of course.
So we can go to the next slide. There we go. Thank you so much. So thank you to everybody for joining our grand rounds today, especially to our speakers and our discussants for their excellent presentations and discussions. We apologize. I see there's one question, two questions. Oh, one question left in the chat. So I apologize if we can't answer all of them. It looks like Sophia put her email in the chat. So please feel free to reach out to the presenters if you have any additional questions. The recording for this grand rounds will be posted soon on the MinSkins website with a link to our YouTube channel. As a reminder, please see the chat for information on how to obtain CME credit for today's presentation. And at the end of the webinar, a brief 3-question survey will pop up on your screen, and we would really appreciate your feedback. We hope you can join us for our next grand rounds on Thursday, November 2nd at noon Central Time, where Dr. Heather Gainforth will present Combating Tokenism in Spinal Cord Injury Research, Advancing the Science and Practice of Meaningful Engagement. So thank you very much and have a great rest of your day.